Foot and mouth disease is on the rise in the U.S. In fact, the American Academy of Pediatrics says they are seeing an uptick in cases among young children more than any other summer. So what can you do to keep your child safe? As we enter back to school season, here's our Shayna Ferreira.
It's the term no parent of a young child likes to hear. Hand, foot, and mouth disease.
It's a very contagious virus.
Most common amongst the youngest of children. Dr. Mike Sirigliano explains.
It can go on for a couple of days before you start to develop a rash on your hands, the bottom of your feet, and in your mouth with these painful ulcers. And so that's why they call it hand, foot, and mouth disease.
The American Academy of Pediatrics says hand, foot, and mouth disease cases are on the rise. Parents should take heed to the warning.
Usually self-limited. However, there are some people that can get very, very sick and need to be hospitalized. Now, I think that just like anything else on the planet, this virus is just trying to eke out a living, and so it spreads.
One of the keys here, according to health experts, is good hand hygiene for both you and your child.
Washing your hands. Make sure that you teach your kids how to wash their hands properly, how to stay safe, and hopefully they'll be just fine.
And because there's no treatment or vaccine for hand, foot, and mouth disease, parents should simply keep a watchful eye.
If you notice that your child is ill, the best thing is to get someone to guide you through the shark-infested waters of illness, and that would be your pediatrician, your healthcare provider that deals with your children regularly.
When did she get hand, foot, and mouth? It was 2. Sia Gethers says as a parent of a now 4-year-old, she's now hyper-aware of the risks.
Keep their hands washed, make sure they're not putting anything in their mouth.
Just the name of the game, though, for kids at this age.
There's data on kids that go to daycare. They get sicker early on, but then they do better later in life. Kids who are going to daycare, they get sick, they get these viruses and things, but then they have immunity, and later in life they're less prone to get sick.
In University City, Shayna Ferreira.